everyone. We will get started for this afternoon. I would like to welcome you all to the Southern Chapter quarterly event. I am Jenny Durand, Chair of the Southern Chapter. I am delighted you are with us this afternoon. I know how busy everyone is, and I really appreciate you sharing your time with us. As you know, the Southern Chapter is part of the Wisconsin Alliance for Infant Mental Health, or WEAIM as we like to call it. WEAIM is a membership organization, and I'd like to encourage you all to become a member, especially now. We have waived all of our membership fees for the year, so a little perk of COVID. Usually it's $60 a year for membership, and right now you can sign up for free. All professionals who work with or on behalf of infants, young children, and their families can benefit from this membership. By joining WEAIM, you will be able to connect with colleagues from different systems and disciplines, stay informed on professional development opportunities, receive reduced registration rates at the WEAIM conferences, share your expertise and experience through submission of newsletter articles, and much more. At the end of the presentation today, we'll be sharing other exciting news from WEAIM, so please be sure to stay on for those announcements. For those of you in early care and education, you will find in the chat box, Abby will be putting in a link to a Google form for you to fill out to make sure that you receive registry credit for the session today. The meeting is being recorded, and we will have it posted in the upcoming weeks for you to share with your colleagues. We will get started and introduce John, our presenter today. John Bruner is a licensed psychologist practicing in the Madison area, originally from Baton Rouge, Louisiana. He earned his bachelor's degree in psychology from Louisiana State University, a master's degree in community counseling from Loyola University, Chicago, and his PhD in counseling psychology from the University of Akron. John Bruner specializes in individual adult psychotherapy and psychological evaluations in children, adolescents, and adults, including assessment for ADHD, autism spectrum disorder, learning disorders, and diagnosis and treatment planning. He lives in the Madison area with his wife and his infant daughter and their cats and dog. Welcome, and thank you for joining us today. And we look forward to thinking more about infant and early childhood mental health consultation in the face of COVID-19. So I will pass it off to you, John.
Well, thank you guys so much also for having me here and for inviting me to speak today. I'm very excited to share some of the experiences I've been having, particularly working with a lot of parents in this age, but also knowing a lot of the stresses and a lot of the problems that we're seeing amongst really very young children, as well as amongst ourselves, right? Amongst our colleagues and other professionals in the field. And I am hoping that you know, through today's discussion, through our presentation today, we can just kind of collaborate to build some insights and awareness, right, of how this pandemic is affecting us. Because I think that there are some very obvious ways that it's affecting us, and some, you know, much more subtle ways that it's affecting us. And I think that it's important to be exploring and talking about both of those things. You know, I also want to be collaborating and discussing some ways of preventing and mitigating some of these difficulties. So the presentation today is going to be divided into two sections: 30 minutes on, you know, presenting on, you know, how COVID is impacting us, impacting working in the field. I want to tie back into the pyramid model, right? And you know, also discussing self-care strategies, right? Not just for our clients, but for ourselves. And then the second half of our presentation today, I want to have an open discussion Now, if there are questions or comments, or anybody has any kind of thoughts or feelings that come up over the course of, when I'm presenting, feel free to, we can either have that message to someone in particular. Was there a plan around, someone receiving some of the messages directly?
I will keep an eye on the chat box, and I know Abby is really great at that also. So between her and I, we can keep an eye on the chat box. I
Sure.
do have everyone muted at the moment just to limit background noise, but
Okay.
if anyone would like to comment or ask a question, feel free to unmute. I think that's
Sure. And feel free to interrupt me or, jump in at any time. Or, like I said, leave something in the chat box and we'll be sure to address that.
perfect.
I also have just some general mantras and some general energy that I want to put out for today, right? Some ideas that I really try to work on with my clients. And, for those familiar with dialectical behavioral therapy, which is really my background, I always kind of look at what are these competing truths, right? One of the big competing truths is that we're always doing our best, right? And we can do better, right? We can validate ourselves, and we can validate those who are working on that this is a really hard time, that this is a really, the may we live in interesting times kind of idea, right? And on the other side, how can we, grow and improve and change? And I think finding balance between those two things, right? How do we kind of hold both of those things at the same time? And another thing that I oftentimes will say is that you cannot pour from an empty cup, right? If you are totally drained as a practitioner, if you're totally drained, then you can't expect yourself to keep giving or keep producing. And that ties back into that idea of what does it mean to be doing our best, right? If our cup is empty, our best on one given day may not be the same as it would be on another given day. So reminding to give ourselves that credit, that validation, and balancing that with things that we can maybe do differently or expand on, change, improve, grow. So, when I was thinking about this presentation, I was thinking about not just the stuff that I'm reading in the literature, not just the stuff that I'm reading online that people are writing. I'm also thinking about some of the things that the parents of the children, that I'm seeing, the things that are causing the most stress, the most impairment, the most impact on our young children and their caregivers, right? I kind of was able to condense these into 3 big categories. Now, I know that those probably aren't exhaustive, but these 3 categories, I think, cover a large portion of some of the things that are really stressing, children and their families. Those 3 things are the social distancing, the degree of uncertainty, and then transmission of the parental stress, to the child. So let's talk about, social distancing first. With very young children, we know the role of touch, right? So we know the role of physical affection. And I would really kind of expand this, right? I would expand this to also be talking about presence, which I'll get to in a little bit. Parental presence in the lives of very young children is such an important variable. It's such an important thing that has correlations with so many outcomes. When we think about the absolute extreme end of that spectrum, when we're thinking about children who've experienced severe abuse and neglect, experiencing reactive attachment issues, I think that we can, in this social distancing sort of era, run into attachment-related problems if there isn't that kind of consistency with touch, if there isn't that kind of consistency with presence. Am I saying that children are going to develop reactive attachment issues? No, but I certainly think that this is a big problem. So I think, we'll get into kind of how do I correlate each one of these with different solutions. But I see this as probably a big area of concern. Also, we know the importance of developing relationships for our very young children, right? Social emotional development in infants, toddlers, young children. They're kind of missing out on a lot of these things if they're not in daycare, they're not in school, they're not surrounded by peers in the same way. And so there are concerns, I think, in developing, those very formative early relationships. So that's another concern that I have. And then obviously too, school and community resources. So many students receive major sources of nutrition, major sources of counseling, major sources of other forms of support through school. And with social distancing, with staying at home, this is another concern. Now, certainly there are community resources that we can be referring folks to. I also think that there is this kind of question, if we have a lot of children in our community, families in our community that are really struggling with the basics. This is where I think that the social distancing can also have a really negative impact. The next one is uncertainty, right? And when I talk about uncertainty, the cognitive complexity that goes into something with a pandemic, it's just developmentally, I think beyond most children, and I think many adults. And the idea of understanding how is it that we're trying to communicate this with our children, it's very important. But I think that the cognitive complexity of the situation can lead to maybe feelings of chaos, feelings of anxiety, lots of increased stress, because this is something that developmentally, they don't necessarily have the cognitive skills, the vocabulary to be able to really wrap their head around. And that's a very difficult thing, especially with our very young children. Now, this last section about transmission of parental stress, considering that my main psychotherapy practice is primarily with adults, this is a big area that I'm working on with parents, and it's a big area that I see as an issue, and it ties back into this other point in uncertainty. A lot of folks are not used to implementing the kind of structure and routine that a child would get at school or daycare, and a lot of times they don't have the skills to know how to do things like setting up a visual schedule or communicating effectively, what the sequence of events for the day will be. And that's a problem. But I'm also hearing a lot of disengagement because of parental stress. So I'm hearing about parents who are emotionally so frazzled, right, and so stressed out that attempting to manage children and working from home, it just exceeds their capacity to cope effectively. So I'm hearing from folks, oh yeah, I let my kids stay up until midnight, 1 in the morning, right? That's some of my older children. But I hear that and I say, do you think that that's going to help those feelings of anxiety or help those feelings of uncertainty, or do you think that that's going to increase it? Now, again, if we go back to this idea of how do we balance these two truths, there is truth that it is really understandable that parents' bandwidth is going to be exhausted, right? And that they are doing the best that they can. And on the other side, right, we have to have a hope that they can improve or grow or implement some change to help their children to navigate this very, very stressful time. So these are kind of some of the primary ways that I'm thinking about. And again, there's likely many other factors, but I kind of condensed to some of them down. These are kind of our big areas that I'm seeing. Now, certainly, I also believe that we are very much affected by this pandemic. And certainly, when I'm thinking about working with very, very little children, infants, I have a 4-month-old at home myself. And when I think about masking, right, and I'm thinking about the implications of wearing a mask, which is so important, right? It's so important to be wearing a mask. And it's also true that for little children who, again, the cognitive complexity, it really kind of trying to explain the rationale behind a mask is not really, that doesn't fit maybe their where they are in terms of their vocabulary. It doesn't fit where they are in terms of their development. And what we also know, though, is that infant and children as young as 4 months, can develop a facial recognition as far as recognizing emotions in others, right? And can recognize stress, or can recognize fear, or can recognize happiness. And so, when we have masking it, which again is so important, we also have to be thinking about how is that having an impact on perhaps developing some of those affect recognition skills. And also that it can be scary, right? If you have a little kid and they walk in to see a doctor, or they walk into daycare, they go into these other places, and a big chunk of their face is missing. The brain wants to fill in those spaces, but when you have a 1-year-old, a 2-year-old who doesn't have a lifetime of experiences to be able to map on what that could be, that's quite frightening. And that attempt to try to fill those voids, again, is a very much of our brain's instinct. And then obviously compliance with young children. Little kids, under, I believe it's the age of 2, number one, can't wear masks. But I think it's also, and Kim was relating a story that, she was having many of her children in daycare that were reaching to take that off, which is, totally understandable. My 4-month-old reaches up to grab my face at all times, pretty much. And so, if there was this funny looking, mask covering my face, that leads to a compliance issue, or that leads to how much uptime can we have wearing our masks. So this is a big issue. And for those providing any kind of services over telehealth, this is another big, obviously bucket of worms. I'm myself am practicing via telehealth. And so, one of the big things that I find that I'm missing out on is a lot of assessment related clues, right? A lot of nonverbals. So the idea of eye contact related to Zoom, what does that really mean? Because if a person is doing this into their camera, right? That's a little bit, that's a little weird, right? And but at the same time, how do you assess eye contact, right, with either a child or with a family doing so? Other nonverbals about posture, right? If I get I've had sessions where I get this high up, right? So I don't know if the person is going like this, right? I don't know if the person is set. There's a lot of loss of nonverbals, but there's lots of loss of other cues, I rely on all my senses to provide assessment. If a client is very malodorous, right? If you have a child who comes in and they're very malodorous, that is a big hint, and we lose that over telehealth. Now, certainly there are other cues that we need to be visually looking for, but there's a loss of that. Connection, lag, buffering. When we're doing telehealth, I use Zoom for my practice. So this is something that is a real annoyance and actually can be a really big barrier. There's a lot of times I have to switch over to phone calls, which is really not optimal in order to finish my sessions. And then there's the physical strain of being in front of the computer screen, eye strain, muscle tension, posture, back pain. All of these things add up. All of these things are very important to kind of recognize. And then the last bullet point about just stress and burnout. Again, when we are in this field and we're having to talk with folks and with our very young children, constantly about the pandemic and constantly having to deal with this. It's always on our mind. It's always kind of at the forefront. And, I think that obviously that's true for many people, but for us in particular, having to talk about and recapitulate these things over and over and over again is exhausting. It takes a real emotional toll. And then obviously too, you combine that with the physical strain of providing, telehealth services. You have the work-life balance of, again, this is my little office at the side of my house. And, if I'm sitting here and I'm hearing my 4-month-old scream, I have that involuntary stress response. And I know that that impacts my, how present can I be if I hear that, right? So, working from home and those work-life boundaries are also quite difficult. And then our own childcare. This is a problem for obviously our clients, but it's, we're people too, and balancing, our childcare situations. So these are all extremely stressful and all very difficult things. But I want to move to how do we kind of respond to some of these very specific things. Obviously, with that social distancing and uncertainty, right? As much as the child would be getting, right, from school, from daycare, from peers, etc., right? Parents, have to step up in that way and provide that presence and provide that physical affection. That's so important developmentally for these very young children. And so talking with, again, balancing this idea of, I know you're doing your best, running around being ragged, and it's extraordinarily stressful, and your little baby needs you right now. Your little kid needs you right now, maybe more than ever, right? And they need you to be present with them. They need you to be physically, connected. So again, obviously increasing structure, right? Increasing reassurance, and making sure that obviously you are tailoring your language to something that is developmentally appropriate for that child. Sometimes I'm working with parents and they're trying to discuss like Wall Street Journal articles with their, 4, 5, 6-year-olds. And I'm like, and how do you think they're receiving that? How do you think that's going for them? And sometimes you have a very smart little kid and they can kind of get some of it. But I think that there's this idea that there's this mismatch between the parents' expectations of what their kids can do, and then what the reality is. Visual schedules. Again, on the 0 to 3 website, there are some really good resources for providing visual schedules and making sure that those things are posted in places, not just in one place, but maybe multiple places. Is it on the bathroom mirror and the fridge, and it's given as a copy for them to hold on to throughout the day, so that it's constantly there and so that they have that constant reminder of what's coming next, right? So they have that kind of reminder of what is the next step in the sequence. Very, very important. So as far as responding to transmission of parental stress, by the way, on the prior slide, I wanted to comment on an article I read recently, which there was a sample of the 13,000. This was in the Charlotte Observer. There was a sample of 13,000 adults working from home, and 42% of them acknowledged drinking on the job. So what does that tell us about the stress level of the general American public? And what percentage, of those, 42% have children, right? And if I'm drinking on my job, right, how much am I able to really be present with them? And again, you balance that idea with that they are doing the best that they can with what they're able to do. Right? And that's where we have to be screening our parents and our caregivers, right? We have to be asking questions. We have to be probing a bit. And I think that I have some on the next slide, some questions, to be asking. but also behavioral observations. One of the things that is nice about telehealth, right, is that I get views into my clients' homes that I would not necessarily get otherwise, right? So this provides me some additional data points. So there may be opportunities embedded in this that you may be able to access. There may be some opportunities to be able to assess things that you maybe wouldn't have access to otherwise. And then obviously being open about referring folks to their own resources and support. You know, getting support from their peers, their friends, their family. You know, getting support from mental health resources in the area. You know, all of those things. Being kind of acknowledging that and recognizing what supports would they need to have in order to set themselves up for the most success. Right, because this transmission of the parental stress is really truly a big issue. Now, again, I talked a little bit about developmental versus chronological and implications. Again, making sure that they're meeting their children where they're at developmentally, and not necessarily having a strong idea of what a 3-year-old should be able to understand, right? You know, what is it that they can understand? Where are they at developmentally? What milestones have they reached? And what is the implication of that? You know, if you have a 3-year-old, right, who's able to read in at a higher proficiency above his or her level, right, as opposed to a 5-year-old who's not at that place, the implications, I think, are very different for how you're going to meet those kids. So I think that that's something that's very important. And also, you know, you don't throw the chronological implications out either, because if there's a mismatch there between developmental and chronological, that also gives you good data. You know, some of the things that I also, you know, things to be asking of parents, right? You know, checking in with parents in order to screen them. So things like using active listening, using open-ended questions. A lot of our, you know, kind of counseling skills or active listening skills, right? So like, I hear Susan's doing really well with the visual schedule. How are you doing with your stress level, right? Reframing and normalizing, right? So what are the big stuck points that y'all are dealing with, right? So instead of saying what are the big problems y'all are having, what are the stuck points, right? Because that infers that, you know, everybody has got these stuck points, right? The next sentence, right? I certainly know that a lot of parents are struggling with a lot of stress. How about you guys, right? Again, normalizing that this is an extremely difficult time, providing that validation as well, right? Like, I know you guys are working really hard with Susan, and I know that you guys are going above and beyond to try to provide these things. And, you know, is there anything that you guys need to be doing to take care of yourselves? Now, I want to acknowledge the pyramid model just briefly, right? This is another way of conceptualizing our interventions, especially prevention. And this is where I kind of, I use a little bit different language, right? So having that effective workforce at the base, again, this is about self-care, this is about checking in on our peers, but it's also about consultation, right? Asking, you know, peers about how might I approach the situation differently. And then I talk about tertiary, secondary, and primary prevention. That's kind of the language that I was trained to use. But thinking about at a tertiary level, what does every child need? Do they need stress management strategies? Do they need educational opportunities for families for recognizing stress in their children? Do they need additional information about resources within their community? These are things that everyone would be able to have access to. And then the next kind of tier up in terms of secondary prevention is identifying who are our vulnerable groups. You know, do we have families that are, you know, in marginalized communities? Do we have families who are at risk for, you know, being food or housing insecure? and providing additional check-ins, programming, linkages to resources, etc. And then at the top of our pyramid is our primary prevention. So at our most high-risk individuals, what are we doing to step in to provide the preventative measures to keep crisis situations from happening? So again, do we need to target some certain subsections of our populations to have routine check-ins, to have more contact with? Again, these are focusing on our most vulnerable families and children. Now, I also talk about, again, the kind of levels of stress that not only our children, our parents, and ourselves are experiencing, right? There's a normal level of stress that is really appropriate to be experiencing during this pandemic, right? That, I think that it's one of those things that when I kind of joke with some of my clients to say, it's like, if you're not at least a little bit stressed out by this situation, then I would be maybe more concerned, right? That there is a normative stress response to a very stressful time, and again, being very validating to that. The kind of next tier up, though, is that heightened stress state, the really significant problems with coping, almost maybe even to the point of adjustment disorder related issues. And then the kind of third tier would be when we're looking more at like psychopathology. Is the child developing separation anxiety issues? Are they developing a depressive episode that might look like, more acting out, more tearfulness, more tantrums, more, statements about, how they feel hated, etc., or panic attacks, etc. So I kind of think that we have to intervene similarly with our pyramid model. We have to kind of clue in about where we need to kind of target. And obviously, too, we needed to clue into our own stress levels. We need to notice without judgment, right? Our reactions to these really stressful circumstances. We need to kind of ride those waves of stress, right? Without adjustment, or sorry, without a lot of judgment, or without the kind of saying either the demonizing or awfulizing of ourselves and our stress and our attempts to cope, right? Again, it's that balance, in my opinion, between doing the best that we can and that we can do better. I wanted to also just talk real quick. This is how I talk with a lot of clients. I know that I'm coming to the end of my little 30-minute half here. But I wanted to talk about real quick self-care, as I kind of will talk with my peers about it, as well as how I talk with clients about it. That I kind of think of self-care as on this spectrum, right? That we have very active self-care strategies, and when self-care gets thrown around a lot, I think that this is where people really kind of like the traditional things for self-care, right? So, as a person engaging in, exercise, hiking, being in nature, are they doing the things like yoga? Are they doing things, again, that doing things, right? I put verbing in quotation marks because I think a lot of folks, they feel the need to verb, right? They need to be doing something. But I also encourage us to say, what makes a person feel joyful, right? What is a person's passion, right? A lot of the people that I'm working with right now, I'm really encouraging to try to find that passion. Now, the other end of the spectrum is the more passive self-care that we need to be engaging in as well. Sometimes we need to reduce the number of obligations that we're engaging in. And, only you can know kind of where that limit is for yourself. But I think that there also has to be that self-love and self-forgiveness and self-compassion to have that willingness to say, I need that step back. I need that more downtime, right? I need to delegate, more tasks. I think that those are all very important things. Practicing more noticing, again, this is mindfulness, but noticing, You know, where's my muscle tension? You know, what is my energy level? You know, where am I at today in the here and now, right? As far as my capacity, how full is my cup, right? Again, we can't pour from that empty cup. And so I think we need this balance between passive and active coping skills. And what I see is I think people get a bit all or nothing, right? So they get to one extreme or the other, right? When I talk to people about what is your self-care strategies, they really talk about exclusively one camp or exclusive the other. And I really try to encourage people to be integrating both and to be thinking of these things as a spectrum, right? It's not, again, a binary, this is active, this is passive, but there's a lot of things that are in between. So with that, I wanted to open it up first just to general questions, comments, or reactions that folks might have. And again, you can either send that as a chat, I suppose, or if someone wanted to call something out.
So, hi, John. My name is Donna.
Hi, Donna.
So I just want to, my reaction is all around that first slide when you were talking about touch and parental presence. I teach infant massage. And so, right in this moment, if we can find ways to embrace families in that space of touch and presence, I mean, that just starts off a whole beautiful path to the relationship building and all the other things that we know, you know, little ones and families need. So
absolutely,
yeah.
Absolutely. That component, and thank you so much for that. That idea of a physical touch, right? You know, I mean, the skin-to-skin contact, right, is one thing, right? And we know that that's so important. But I think of also presence as being important. And there's all of these levels to me. I read a book called Therapeutic Presence once. And it talks about how we have these tiers of presence, right? You know, we can have physical presence where, you know, if I have a person who's in the hospital, right? Sometimes they just need a sitter to be there, right? That physical presence. But there are all these different levels up, right? To where, you know, thinking about how present am I truly being with my child? I know I was talking with Julia a couple of days ago about this. Is that I find myself, right, when I am feeding my 4-month-old, right, with I have a bottle in one hand and I'm scooping her up with the other, and that hand is also simultaneously trying to grab the remote, it's trying to grab my cell phone, it's trying to grab my cup of coffee, right? So where is my level of presence being with my daughter, right? You know, where is my level of real contact? Not just physically, because obviously I have the physical contact, but am I truly being present? So yeah. I encourage people one thing at a time. Sorry,
right.
Go ahead.
Yeah, no, the same thing, the difference between, you know, being with versus doing to, right? We have all these opportunities, you know, where there's time or a moment to be with, but often we're doing to, you know, we're changing a diaper or washing a face or, you know, whatever it might be, where if we just shift the mindfulness around that to, you know, if it could be with instead of to makes a huge difference.
Yeah. And I also think, and I really appreciate that, because again, that being and doing, right, is this big balance we always have to strike, I think. And I think that's especially important right now, because I think there's this big push that we need to be doing something. We need to be learning a new hobby. We need to be doing yoga. And I'm like, Well, that's true. And it's also true that, we need to be present, we need to be mindful, we need to be in the here and now. Because if those scales get out of balance, then I think that it's hard to be centered, it's hard to be present. Well, I saw something pop up in the chat. Was there something in the chat?
Yeah, Kim has a question that she asked, what other things can you do when your smile is hidden from children to convey happiness?
So the question was, what else can you do to convey your happiness when your face is hidden behind a mask? Now, I think that there's a couple of things, right? So one thing is that there was this thing that was going around that I had really kind of struggled with, this idea of smizing, right? So like you smiling with your eyes, right? It's like, what does that even mean, right? And I was talking with my dad, who's a surgeon, and he said, a lot of the times, adults, right, can read your eyes crinkling in a certain way to suggest that you're communicating that. But children and infants don't necessarily have that whole gamut of experiences, right, to be able to infer that is what the rest of the face is doing. So what I think that I've seen that has been so creative that I really love, right, is I see this on the news. I see this in like ICUs and etc. Is that you see people who have a lanyard, and on the lanyard is a picture of themselves smiling, right? Or they have a picture of themselves, so that the whole face can be kind of seen. Now, the other idea that I had that was related to this, I couldn't dig up the picture. I had a face mask, this was actually a couple of years ago, that had like a little tiny cute smile just right on the front of it. It was almost like a cartoony kind of thing. I think of that as being something that could potentially also convey that, right? Little children, at a very young age are able to not only discern, but prefer human faces, even over things like, geometric patterns and other objects, right? They prefer that, right? And so if there's some way that even on the mask itself, we could, draw something, or we could, there are plenty of people that are printing masks right now you can buy online, that you could get creative and find ones that have, either just like a little cute smile or just something to suggest that would complete that kind of blank space that their brains want to complete. Does that make sense for folks? Yeah.
Yeah. And just one more comment about the mask. I work with a lot of children with special healthcare needs and medically fragile children, and their experience with masks are oftentimes very different than, the general public use with masks. And I think that's something that, again, just some mindfulness around not every child's history with people in masks is the same.
Yeah, I mean, I think you're absolutely right. Thinking about kids who have experienced, real trauma associated, psychological, emotional trauma, and physical trauma. I mean, physical trauma from, being medically fragile, or from experiencing, illnesses, injuries, surgeries, hospitalizations, right? Can correlate that mask with what? Oh, this person's coming to give me a shot. Oh, this person is coming to poke me, prod me, make me hurt in some sort of way. And so if we're not, thoughtful about that sort of a thing, I think we could see a kid who could just have this big reaction. And if we're not being thoughtful about that, it can be very easy to then assign some really unhelpful, ineffective labels or ineffective kind of ways of thinking towards those children and their behavior. Other general thoughts or reactions?
Kim just commented in the chat. She says, I think you can have a really positive tone in your voice to convey happiness as well, and thumbs up, or there's other gestures that you could use.
Yeah. So, I mean, again, I talk about nonverbals, and then I talk about paraverbals, right? So nonverbals are, again, all that body language, posturing, right? And facial expression, affect. But I also talk about paraverbals, like our volume, our tone, our rate, etc., right? If a child cannot really discern what our emotional state is because we're behind a mask and we're really stressed out and are short, right? I think it's really logical that they would jump to the conclusion that, well, they're mad at me, or, well, I'm in trouble, I did something wrong, right? I think that that's very understandable. So we really have to be thoughtful about these things. I wanted to talk about some of these other discussion points, unless other people have just sort of general questions or reactions. What are the other big stressors that we're seeing out there right now? Are there other things that, we're dealing with? And one that I think is quite common is distancing from family members, right? Why wasn't grandma or grandpa at my birthday party, right? Why were they just on Zoom? Which Zoom is great. I mean, it's great that they can at least be there, right? But again, we talk about touch and presence, right? And I don't know that we can equate those things. It's the best that we can do right now, right? So other stressors that folks are seeing. If not, some of the other kind of things that I wanted to make sure that if people had thoughts or questions about would be, what are you guys doing to take care of yourself during this time? And are there any kind of silver linings? Are there any positive reframes? Again, you have to balance that, of course, and be very careful between looking at what are those positive silver linings or positive reframes, and not being invalidating, right, towards a person's experiences, a person's pain, a person's stress, right? But I think we do a disservice to not acknowledge if there are, silver linings or positive things. So thoughts about that. What are we doing to take care of ourselves, or possible silver linings, possible positive reframes?
In the chat, there's a kind of a self-care note. One thing I do to help take care of myself during COVID is to remember I can only control my own actions. I can't make others wear a mask, etc. And letting go of that thought process helps me to regain my own control. Yep.
A big portion of my clinical experience was in inpatient mental health, right? It was in psychiatric care. I used to do these groups in front of these big, units, mental health units. And one of the groups that I'd bring in a hula hoop. I'd take that hula hoop and I'd put it on the ground and I'd stand in it and I'd say, everything that I can control in the universe is currently inside of this hula hoop, right? Everything that I can control is right here. And so, remembering that there are so many things that are outside of our control, right? And remembering too that there's a lot of things that we think we have control over, right? But that can be something of a trap. That can be something of an illusion, right? Thinking that I can control the opinion of another person, or an opinion of a parent or a caregiver, right? got to be very careful, right? You know, we have to step back and say, well, what is it that I can really control? You know, number one. And even with little children, right? You know, even with a 4-month-old, right? Again, speaking from personal experiences, I can set my 4-month-old up for all the best things to make sure that she goes to sleep tonight, right? And she cannot sleep. So, you know, again, we can't, there's many things that are outside of our control, and we have to make sure that we're not really attached to that idea. So I really appreciate that comment.
A couple more comments from the chat box. One, this has been an opportunity for self-reflection and discovery. And then the other comment is, I'm giving space for my students to have regressions without judgment.
I'm sorry, can you say that last part about?
Yep. So Kim again says, I am giving space for my students to have regressions without judgment.
Sure. And to recognize within the kind of bell curve of what are normal stress reactions in these very young children, right? And that developmental regressions, right? Or you know, just behavioral regressions in general are completely understandable given those things that we talked about. Again, are my parents transmitting that stress or that energy in a way that children can very much pick up on from a very young age? And thinking about all of that level of uncertainty, right? And adults, I mean, it's like, you know, we're not immune from those things too. But I think that giving space, Kim, I think that is a very important thing to always keep in mind. And I really appreciate that comment. Other thoughts or feelings, other things that maybe even people are struggling with that we can talk about, or other things that we can share? Well, if not, I appreciate the opportunity here to come and present for you guys. Again, I think that I wanted to say thank you to the Southern Chapter, and I wanted to say thank you to Julia and Kim and for having me. I can provide my contact information in the chat. So should anybody have any other questions or concerns, or need to get a hold of me with other follow-up or even potential referral sources for mental health that people might need to have, people can always you know, reach me by email, or they can also reach me via Kim. So if there's anything that you guys might need, I want to make sure that I'm available for that.